Heather King. I am the health director at Brook. Brook is a personal health companion. We have been around for about 3 years. We're available on iOS, Android for smartphones. And the way that I got into this, I am a dietitian and diabetes educator, and I was a provider for over 10 years. And what I saw, and this is something that many providers would concur, that they see people coming in and having that face-to-face interaction and getting a care plan or setting goals, for instance, and then they go back into their lives, right? And we just kind of go back into the way things are. And there isn't access to having our everyday questions answered. And we know that those everyday decisions are what really makes us healthy, right? The answer to figuring out what to do every day. Likewise, there isn't the accountability for sticking to a care plan and sticking to goals. Our CEO, Orrin Neeson, has type 2 diabetes. That was his initial interest going into this. A lot of his family members do too. So we started out tackling diabetes. We have moved into other verticals, including hypertension, combined diabetes and hypertension, and general health. So really anybody can get on the system. So the problem that we addressed is that accountability and access in between those pillars of medical care, which is kind of the traditional face-to-face visit with your doctor. So this is meant to be an adjunct to that. The way we're tackling that is twofold, really. There's two main features to our system. One is a chatbot, and what that does is aggregate data from the user, a lot of it collected ambiently, so using sensors on the phone, using Bluetooth-connected glucometers or blood pressure cuffs, and then taking that data and making it make sense to somebody so that they can pull actionable insights out of that. For instance, knowing your blood sugar every day doesn't actually make your diabetes better. Knowing how many steps you take doesn't make your diabetes better either. But knowing that when you reach 5,000 steps, your blood sugar is 15% lower on those days, that's an actionable insight. Because now you can say, if I get to 5,000 steps, I'm going to be better with my diabetes today. So the chatbot gives those insights back as more and more data comes in. The second main feature is a live team of experts. We call it the Brook Expert Team. It's dietitians, diabetes educators, nutritionists, and registered nurse practitioners that are available 7 days a week. And people write in with questions like, I'm standing in front of a wall of yogurt and I don't know which yogurt to get. You've all been there, I'm sure. Everything from that to, my blood pressure has been trending high and I don't know why. And so we'll enter into a conversation with them trying to figure this out. It's really based on lifestyle medicine. And so that's our focus. And we plan to expand into other verticals and move forward with that. I have 2 members of my expert team here today and 1 from the product team, and we're going to be over at a table. You can come talk to a live registered dietitian.